Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is an overview of RSD and CRPS. RSD stands for Reflex Sympathetic Dystrophy, CRPS, Complex Regional Pain Syndrome. Both of these represent a chronic pain neurologic syndrome that's very frustrating to both patients and doctors. The basic problem represents an overactivity of the sympathetic nervous system that results either from trauma, from surgery, or an unknown cause. In 1993, the International Association for the Study of Pain changed the name from RSD to CRPS to try and better characterize the condition. However, both terms are still widely used in the public's repertoire. It's unclear about the total numbers of people with RSD and CRPS. We think it's up to 12 million. Three-fourths of those afflicted are female, and we don't know a lot about it. We know overactivity of the autonomic nervous system. The trigger sparks up the autonomic nervous system and it just doesn't shut off. The symptoms include severe burning pain that is intense and much stronger than would be expected for the injury sustained. The pain gets worse over time rather than better. It starts at the point of injury, but it can spread to the whole leg or arm and even the other side. There's often significant sweating and swelling in the tissues, extreme sensitivity, bone and skin changes, and then possibly insomnia and emotional problems. There's 3 stages. The first stage is the first 1 to 3 months where you have the skin temperature changes, muscle spasms, severe burning pain that worsens with even the slightest touch. Hair and nail growth is faster than normal in the area, and the beginning of skin changes such as blotchy, pale, shiny, sweaty skin. The second stage is from 3 to 6 months, and that's when you start to see more skin changes, cracking of the nails. The pain continues to get worse. Hair growth starts to slow down, and then weakening muscles and stiffening joints. It hurts so much to move some of your joints in these areas that people just don't do it, so they start to get stiff. The third stage is when irreversible changes occur. You start to lose a lot of muscle mass, entire arm or leg becomes involved, and you get contractures, not just stiffness. So the treatment options, it is hard to cure, but it can be slowed and reversed significantly. Physical therapy can be very beneficial. They can do some desensitization activities. Medications may include narcotics, antidepressants, blood pressure medications, anti-inflammatories, steroid medication, neuropathic meds like Lyrica, Neurontin, even calcitonin. A nerve block like a lumbar sympathetic for the lower extremities or a stellate ganglion block for the upper extremities can be sensational. If those work and then wear off, you can do those again, or then move on to a surgical sympathectomy where you just take those nerves out. A last resort may include a spinal cord stimulator or an intrathecal drug pump. Treatment outcomes depend really a lot on timing. Earlier treatments do work better. A large JBJS study back in the 80s showed if treatment was started within 2 years of onset, you can get 80% good to excellent outcome. 2 to 5 years, 70%, and then over 5 years, you really are much decreased, 10 to 20%. The Annals of Neurology looked at spinal cord stimulators for RSD in 54 patients, showed an extremely favorable long-term outcome with minor complications. Spinal cord stimulator movement during motion used to be an issue, but the newer ones don't have this problem. Like when you go from a sitting to a standing position, the new ones adjust for this. Lumbar sympathetic block and stellate ganglion blocks. Anesthetic is injected into the ganglia region. It warms the skin immediately. That's how you know that it worked. The pain relief may occur within a half hour and last for days to weeks. You may need 1 to 2 blocks per week with upwards of 5 to permanently relieve symptoms for months and months at a time. And then, as mentioned, operative sympathectomy may become necessary. RSD and CRPS is complicated. There's a lot we don't know. There's a varied presentation. So combination, individualized treatment is typically best and leads to the most successful outcomes. The goal really is to break the cycle of the sympathetic overactivity and to reduce the ongoing pain. The top non-operative pain management in the Dallas-Fort Worth Metroplex area is through the Texas Pain Network. There are several clinics in the region accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.